This is a CJSON podcast, and I am Raja Dandamudi from the Division of Nephrology, Hypertension and Fibrosis at Washington University in St. Louis School of Medicine. It is my pleasure to share with you the results that are described in the manuscript titled Longitudinal Evaluation of Donor-Derived Cellfree DNA in Pediatric Kidney Transplantation. Donor-derived cell-free DNA is a dynamic marker of cell turnover that can be used as a non-invasive marker of allograft injury. Refining it for effective clinical use is an ongoing effort, and there is paucity of evidence in children. In our study, we aimed to determine longitudinally assayed donor-derived cell-free DNA levels in pediatric kidney transplant recipients at the time of different allograft injuries like acute rejection and polyomavirus infection. We also tried to understand the kinetics of donor-derived cell-free DNA post-kidney transplant in stable children and to assess the prognostic relationship between donor-derived cell-free DNA and allograft function. At our center from January 2013, we initiated a prospective biobank of monthly plasma, serum, and urine sample collection for the first 12 months post-transplant. Donor-derived cell-free DNA was quantified as a fraction of total cell-free DNA by next-generation sequencing using a targeted multiplex polymerase chain reaction-based method for the analysis of single nucleotide polymorphism. Analyzing our results, the donor-derived cell-free DNA levels in children remained persistently elevated for at least 4 months post-transplant, and this elevation is more so if there is greater disparity in size between donor and recipient before reaching a steady low level of 0.4%. We demonstrated increases in donor-derived cell-free DNA in the setting of acute rejection with an area under the curve of 0.82 at a threshold of 1% for the detection of biopsy-proven acute rejection episodes. During BK-viuria or viremia, patients had significantly higher median donor-derived cell-free DNA levels than before or after episodes of BK-viremia and viuria. The area under curve to detect BK-viuria was 0.6 and to detect BK-viremia was 0.67. A donor-derived cell-free DNA level of more than 0.5% predicted a wider spread in estimated glomerular filtration rate over next 30 days, but not 12-month outcomes. The wider spread of estimated glomerular filtration rate implied bigger subsequent decline in estimated glomerular filtration rate. Our findings suggest donor-derived cell-free DNA is a valuable, less invasive biomarker for the assessment of allograft integrity in pediatric kidney transplant. Thank you.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.